So what exactly is home care? Who needs it and who pays for it? Tara here from Aging Your Way, and I am happy to answer these questions that I have been asked countless times over the 20 plus years that I've worked in home health care. In this video, I will help you understand the basic components of home care and provide answers to those common questions, especially who pays for it. I definitely understand why people often feel confused about what home care is. There are different types of home care, and even healthcare providers use the term home care to mean many different things. So it is not surprising that the average person is confused. In my last video, I discussed medical home health care, which includes nursing, physical therapy, occupational therapy, and a few other services. That is the type of home care that's typically covered by your medical insurance if your physician orders it. In this video, I will discuss non-medical home care services and who benefits from these important services. If you plan to age in place, please continue watching. To avoid going to a nursing home in your later years, you will likely need non-medical home care services at some point, and maybe medical home health care too. On to the key components of non-medical home care.
Non-medical home care is also referred to as non-certified home care, private duty home care, private pay home care, or in-home care. To keep things simple, I will refer to the home care I discuss in this video as non-medical home care. However, some non-medical home care agencies provide basic medical services such as a nurse coming to your home to set up medications, check blood pressure, give injections, and other services. Many non-medical home care agencies do not provide any nursing services at all and only provide these typical home care services. Here are the services typically provided by a non-medical home care agency. Personal care services included but not limited to assistance with showering or washing up, assistance with safely getting dressed, assistance with brushing teeth, brushing hair, etc. Homemaking services, including but not limited to light housekeeping, doing laundry, meal preparation and cleanup, organizing a room, a closet, etc. Companion care services, including but not limited to reading to the client, watching TV or movies with the client, playing board games or card games with the client, or going for walks with the client. Transportation to medical appointments, barber or hair salon, post office, library, etc. And errands, including but not limited to grocery shopping, picking up prescriptions, or other requests from the client.
Please be aware that if you receive any of these services and one of the funding sources I'm going to discuss in a minute is covering the cost, the services of the home care agency staff may be limited by restrictions in place by the funding source. However, if you are privately paying for home care services yourself, the agency staff will likely be able to do more tasks that you request and need. One important tip: always ask the agency staff if they can do certain tasks, such as give your loved one their medications or help your loved one put on a complicated back brace. Please don't assume that staff can do these things, especially without you asking in advance. The people who provide non-medical home care are often referred to as caregivers and are usually kind and big-hearted people who just want to help others. Of course, there are a few exceptions to this, and in my next blog post, I'll tell you how to spot a caregiver that isn't providing good care to you or your loved one. Also, the people who provide non-medical home care are usually not licensed or certified medical professionals. While some agencies provide basic medical training to their staff, such as monitoring for common medication side effects or signs of low or high blood sugar, not all agencies train their staff to do these things. Again, please don't assume that agency caregivers are trained to do these tasks. It's always better to ask first. The agency usually provides non-medical home care in an hourly model, not a visit model like medical home health care. Now, a very important thing to know about this is that non-medical home care agencies often have a minimum number of hours per day or per week that you must agree to. For example, the agency might require a 4-hour minimum daily requirement, which means if you want a caregiver to care for you or your loved one, you must agree to have the caregiver there and pay for at least 4 hours at a time. Also note that the more hours you need, the more caregivers the home care agency must have available. So I highly recommend looking for a home care agency before you desperately need those services right away. Many non-medical home care agencies, but not all, provide 24 hours a day care if that is what's needed. The agency's ability to provide 24-hour care to you or your loved one is based on the number of staff they have available to provide 24-hour care when you need it. So, who benefits from these non-medical home care services? Basically, anyone who needs any of these services I listed above. You do not need to have a specific health condition to qualify for non-medical home care services. However, a specific health condition or a general decline in health and function is usually the reason that a person needs these services. It's important that you share all of your or your loved one's medical history with the non-medical home care agency that you hire to ensure that they can provide the care that you need and want. The next question on everyone's mind is who pays for non-medical home care services? This is an excellent question, and there are a few possible answers. Often you or your loved one must pay for non-medical home care services with your own money. That is why these services are often called private duty or private pay services. If you have access to certain funding sources, non-medical home care services are covered within certain limits and restrictions that vary by the source. Long-term care insurance, specific Veterans Administration benefits, Medicaid under the Medicaid waiver program, or the Older Americans Act funding all cover non-medical home care services. Under certain and specific criteria, some medical insurance plans will cover limited hourly home care. This is the exception and not the rule, and please know that the insurance company decides who qualifies, not the home care agency. I always recommend that you contact your insurance company and ask if your specific situation and diagnosis will qualify. And the important question that many struggle to get an accurate answer to is how much does non-medical home care cost? This varies greatly depending on where you live in the United States, so it's not easy to just look up the average cost on the internet. In the US, the costs of non-medical home care typically range from $20 an hour to up to $30 an hour or more in some cities. A difficult reality of aging in America is that this price point is unrealistic for so many older adults and their families. Government entities at the federal and state levels have slowly begun to provide more funding for older adults to receive home care services not covered by Medicare through certain programs. But this funding is not widely available to all seniors, so it doesn't feel like nearly enough is being done to meet the growing demands for coverage of home care services. After working with older adults for 25 years, I know so many people who could have avoided a hospitalization or even a nursing home stay if only they had caregivers coming to their homes to provide the services I discussed above. Sadly, many older Americans and their families just can't afford these services and often end up spending their last years in a nursing home. After they deplete their personal finances paying for the nursing home, they are then allowed to apply for Medicaid. The cost of being in a nursing home to you or Medicaid at some point is $100,000 per year on average per person. I sincerely hope that we as a society can identify a better way in the near future to take care of our older adults in a more cost-effective manner. Understandably, there are many people who resist having caregivers come to their home. but I hope you will consider it if it's offered to you, provided that you can afford it. And if you can't afford the services, please don't hesitate to ask the home care agency if they're aware of funding sources that you could access. Most agencies are happy to help you identify funding sources. One last comment about the cost of non-medical home care. In my experience, most non-medical caregivers are not highly paid. Their hourly rate is usually around 50% of what the agency is charging for the care. Where does the other 50% go? To find out, watch my next video in this series titled Confused About Home Care? You're Not Alone, Part 3. In my next video, I'll share little known tips from an insider perspective so you will know what to expect of a non-medical home care agency and how to tell if they are doing a good job taking care of you or your loved one. If you would like more information about non-medical home care, please read my latest blog post titled Confused About Home Care? You're Not Alone, Part 2 at agingyourway.net under the blog tab. And if you would like help with determining if you or a loved one needs home care, feel free to click on the Services tab of my website to learn more about our Aging Advisor services. The initial 30-minute consultation is always free. Thank you so much for your time. Feel free to leave a comment below if there's other topics like this that you would like me to address. And don't forget to like and subscribe below as well.